My name is Kristen Baker, and I'm going to be performing my urinary catheterization skills checkoff today. I have my provider's orders. They are for Charlene J. Knight, allergies, latex, penicillin, betadine, and her date of birth is 8/8/1939. The order is for Foley catheter insertion due to urinary retention because the patient is unable to urinate. I would go into her room and perform hand hygiene. Hello, Mrs. Knight. My name is Chrissy Baker. I'm going to be your nurse today. Would you please verify your name and date of birth for me? My name is Charlene J. Knight. My birthday is 8/8/1939. All right, what are your allergies, Mrs. Knight? I'm allergic to latex, penicillin, betadine. All that's verified and accurate. Mrs. Knight, I see that your physician has ordered a urinary cath for you because you are unable to urinate. You have some urinary retention. Yes, I do. I haven't been able to urinate in the past 10 hours. All right, Mrs. Knight, the Foley catheter will help with that. I'm going to assess the area to make sure it's appropriate for me to insert the Foley catheter at this time. So, I'm going to set this down. I'm going to perform hand hygiene again, just to make sure my hands are all perfectly clean. I'm going to grab some gloves. All right, Mrs. Knight, I'm checking for any discharge, swelling, irritation, redness, or just about anything that would contraindicate insertion of the Foley catheter at this time, which I do not see. Your perineal area is very clean, so I don't need to perform any care at this time. I can see you're urethral meatus, and I'm going to palpate your bladder. Yes, you have some tenderness and distension. Sorry, Mrs. Knight, this Foley catheter should help with that. All right, I'm going to cover you back up in privacy while I get everything ready. I'll be back in just a minute to insert the catheter. I'll remove this. I'll grab my orders and I'll come out to my table. I'm going to perform hand hygiene again because I just had some gloves on. And now I'm going to check my provider's orders with my catheterization kit. My kit is not expired. Everything is intact. There's no rips, tears. It's not soiled or wet. It doesn't contain latex, penicillin, or betadine, which my patient is allergic to. Normally these kits would contain latex and betadine, but because Mrs. Knight's allergic to it, we do not contain that. And it is a size 14 French, which is what is on the provider's orders. Now that I know these orders, I'm going to place them out of my way. I'm going to prepare my kit. I'm going to take it and open it and throw this away. I'm going to take it out and set it on a clean, dry surface. Throwing that away. I'm going to turn this bag into a trash receptacle for my cotton swabs and place it at the end of my patient's bed. And I'm going to position my patient at this time. Since I've touched everything, my hands are not clean. I'm going to perform hand hygiene once again, making sure that my hands are dry before I touch my sterile field. Because I'm done with this, I'll move it out of my way so I have room. My hands are now dry, so touching only the 1-inch margins, I'm going to open the kit using first the flap away from me, making sure that nothing folds back in on itself, and the flap to the side, the flap to the other side without crossing my sterile field, and then the flap closest to me. I can only touch the 1-inch margins to adjust my kit, making sure I don't touch the field. Next, I can place this drape, holding the shiny side to me, only touching the 1-inch margins. I step back and let it open. I can drape it on my patient, shiny side down. work my way around the outside of the drape, making sure that it lays flat, but not crossing it. That's in place. Now I need to put on my gloves. I'm going to step to the side, the cuff end facing towards me, but still keeping both of my things in view. This is my extra pack of gloves in case these rip. Now touching only the inside of the cuff of this glove with my non-dominant hand. I'm going to pick it up and take a step back. Insert my fingers. Still watching both of my sterile fields. Now for this hand, I would keep my thumb abducted. And insert my fingers underneath, taking a step back. Inserting my fingers. Now if this is on, I can touch these to help adjust, to keep them in, because I'm touching sterile on sterile. Alright, I'm done with this, but because it is no longer sterile, I'm going to use it to place my trash so my hands do not go below my waist. I'm going to lay this straight, take a step back, open it. I can touch anywhere on it because my hands are now sterile. And I laid it on my patient. Now I'm going to adjust my kit, touching the box. I'm going to open it and take a step back so no water splashes on my kit because water makes my kit no longer sterile. I'm going to pour it on my cotton balls. Now I'm going to use my lubricating jelly. Move this tray over to the side. Being very careful to keep everything within the 1 1/4. I'm going to remove the cap off of my syringe full of sterile water. Normally, if my kit required it, I would test the balloon by inflating it. But this kit does not require that, so I will not do that. I'll attach the bifurcation where it states that 5 to 10 milliliters of sterile water can be used to inflate the balloon in the catheter, which I will record at the end of my video depending upon how much I used in the kit. I'm now going to remove the sheath, being careful not to let it flail to become contaminated. We'll lubricate it. Put it back in here. I don't need this. I'm going to put this on the corner of my kit. Got everything prepared. So I'm now going to make my way over to my patient, making sure not to touch anything. That's okay. I'm now going to purposefully contaminate this hand to hold the labia apart for my procedure. I will take a cotton ball and clean outer, down, outer, or inner, down, middle, down, outer, down,